Are you worried about fibroids? Does anyone you know possibly have fibroids? Can you prevent fibroids? Learn everything about uterine fibroids. Go to freeoffibroids.com and free yourself of fibroids forever using a unique 3-step process.
When it gets pushed out with these fibroids pushing against it like that, you'll end up with a scenario where you're really uncomfortable, and that discomfort you face calls for action. The question is, what are you going to do about it if this is what your body looks like on the inside? Ladies, thank you very, very much. Come on out. So go have a seat over there. We're going to talk a little bit about options. So, Dr. Shepard, walk everyone through the options about getting their fibroids removed and what we can do to avoid that process in its entirety.
And I think that's the important thing, is now women have options.
So let's go through. First, obviously, for years, when people thought about hysterectomies, it was synonymous with having a fibroid. And I do think this is the overperformed operation of our decade. So I think that's changing. Is that your impression as well?
Absolutely. You know, a woman does not have to have a hysterectomy simply because she has fibroids. Now, that is the most common reason why we do perform hysterectomies, but I think the beauty of science and technology is that we have so many other options that we can offer to women, and it really depends where they are with their journey with their fibroids.
So let me ask Crystal.
Yes.
Your thoughts on hysterectomies. You offered that as a solution, and
No, painkillers.
you were given painkillers, Crystal.
We are offered painkillers, especially when I was pregnant, yes. I was just like an option, so it would not be a problem in the future.
Eric, how about you?
Actually, my doctor told me I could never have kids with the type of fibroids I have.
My goodness.
That's unfortunate.
How long ago did your doctor tell you that?
Actually, it was a phone conversation last week.
Oh. Well, Eric, I want you down as well. I hear this all the time.
Yes, my doctor and I discuss it frequently, but I'd rather be natural. I want to wait for maybe menopause and have them shrink naturally.
Let's go through all these scenarios then. So I'm hearing painkillers, I'm hearing infertility, and I'm sorry about the conversation. It should have taken place in person, but it's painful no matter how it's heard. And then the issue of whether you can do it without any major intervention. So first, walk us through the first option of whether or not a dietary approach actually does make sense.
So for Crystal, she's been given, pain medications, which may or may not be helping, but she does have options with dietary modification. There have been studies that have been done on dietary modification, but she can also have things such as a uterine artery embolization, which just occludes the blood supply specifically to the fibroids. She can have a procedure where we remove the fibroid from inside of the uterus with a myosure, and that is a very minimally invasive surgery. She'd be in and out the same day. So the myomectomy simply is taking the fibroid from the uterus and leaving the uterus intact. And so the beauty of this surgery is that you have very small incisions, which can range anywhere from 0.5 centimeter to 1.5 centimeters. Your recovery time is reduced, and these patients really are satisfied with their procedure and the outcome. And again, that's something that can be discussed with one of your physicians.
So when we talk about natural, the most natural thing is to eat naturally.
And so that's somewhere women can start with. So when we talk about foods, we really want to hone in on avoiding high index glycemic foods and high fatty foods, and focus more on our foods that have high vitamin D levels. So we're going to talk about our citrus fruits, our green leafy vegetables. We have our vitamin D milk, anything that's really going to increase that vitamin D level.
So I'm covering this because African-American women have a much higher incidence of fibroids, and we think it might be linked to the vitamin D levels, which are lower in African-Americans.
If you want to look at the numbers, it really is significant. By the time a woman reaches the age of 50, up to 50% of women have fibroids. In African-American women, 80%. 80% by the age of 50. So that is a significant difference. So if there's something that you can do as simple as dietary modification, I think it's definitely worth it.
So you're all clear on this. You're going to cut down to some of those simple carbohydrates, which you ought to do anyway.
Yes.
A little bit less of the fatty food, and get your vitamin D, and at least you can reduce the chance of that fibroid either being there or growing large enough to cause you symptoms.
Yes.
Thank you for being here. I hope that was helpful. And I want to talk to each of you afterwards, because I do think that there's a lot of fear around fibroids. Part of the reason I want to do the show today is to show everybody there are things you can do that are either non-invasive at all with food or minimally invasive, so you can actually do things you want to do in your life without losing your uterus. We'll be right back.
Go to freeoffibroids.com.